Hi, everybody. Yeah, it's a lot of things. I forgot I wrote all that. Thank you, Tiana, for helping me write it. Where to start? I'm happy to be here. I'm grateful for the Metaphysical Library for this space. Thank you. I'm happy to see familiar faces, some of who I've seen for a couple years, which is pretty awesome. Yeah, I've done a lot of things. In Pennsylvania, I primarily worked in primary care. I was a family practice doctor. I did that for years and years, and as you heard in the bio, saw all the different, the goods and the bads that go along with the Western medical model. And it's been a journey. Writing this talk or doing this talk, creating this talk has been a journey too, where I've really had to pull together so many different things and try to get it all to one kind of concrete conclusion. But that's a little, it's difficult because there's so many things. Yeah, actually, does anybody ever heard of the gene keys?
What?
The gene keys. It's a system. It's sort of based on like your astrology and a bunch of other things. But in that, there's these different spheres, and the sphere of the life's purpose or your life's work. For me, it's this word quintessence, which is a pretty cool word. Quintessence, the essence within the essence within, like the simplest, clearest this sort of thing. So I was contemplating that, and I thought, what's the quintessence of all the years and all the stuff and all the things? And what I came to was this.
You think you should read it?
You don't need anything, and there's nothing I can do for you. And the reason for that is you already have everything you need. Really, 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 really for real, here and now, all the time, never not. It's there. So I'll spend the next 2 hours trying to convince you of that. You never change things by fighting the existing reality. To change something, build a new model that makes the existing model obsolete. I first saw this quote on May the 4th, 2017 at an event with Bob Proctor, who we'd mentioned before. And it was really an inspiring thing. And I remember at this conference seeing that, and I was kind of right in the middle of my whole, doctor career, and I was getting to that point where really seeing like, there's got to be something more. There's got to be something more to do. And I thought, I'll create a new medical model that makes the existing medical model obsolete. And I remember going through this thing of, oh my God, I spent so many years and so much training learning how to be and I'm gonna have to give it all up. And I had this breakdown, and I was crying, and it was next level. But it was a really profound thing, and I made a decision, and then it just so happens that exactly 3 years later, on May the 4th, 2020, is when I left Pennsylvania to drive to come to Ashland, and really start this journey of taking all the knowledge and all the good things and all the things I've done and trying to bring it into a form for people in my own unique expression. So I've kind of called my practice Liminal Osteopathy. The liminal. Occupying a position at or on both sides of a boundary or threshold. And when I thought about really stepping out on my own, it was, it's that meeting point between, science and spirit, the, formless and form, in that in-between place. the water and the wave. The wave is always the water. But at what point does the water, the ocean, become the wave? There's this space, this transition point, where it's both and neither. So it's from this place I'm inspired to work. Hence the name Liminal Osteopathy. So what we will go through today, there'll sort of be two parts to it. The first half will be going through kind of not the whole history of osteopathic medicine, but sort of the key things, the original ideas and concepts that the discoverer of it, Andrew Taylor, still came up with. And then sort of a brief thing of what it's become. And then from there, the second half, we'll see. I don't know. The second half may be more of a meditative pointing sort of thing, but we'll worry about that when we get there. So, what is a DO? Open that to the audience. Hey, people, Doctor of Osteopathic Medicine.
A doctor of osteopathy learns very special manipulations for the skeletal system.
Mm-hmm.
They learn to manipulate that in order to bring the
Mm-hmm.
patient into a state of greater ease.
Mm-hmm. Yeah, so everybody's been, if anybody's been to the doctor, the regular doctor, there's an MD doctor and DO doctor. And most folks, what is an osteopath? What is osteopathic medicine? Has been my common thing. Osteo must have something to do with the bones. It does and it doesn't. So we'll go through all the things associated with that. Then there's lots of terminology. She mentioned osteopathic manipulative medicine. We'll hold our questions to the end.
Okay.
Was my advice. So osteopathic manipulative medicine, and then there's osteopathic principles and practices, and there's an osteopath and a doctor of osteopathic medicine. There's all these different terms, and it's kind of confusing. Technically, in the U.S., a doctor of osteopathic medicine, a DO, is a certain thing. But when you use the term osteopath, in England and in Canada especially, they're not doctors of osteopathic medicine. They do the original thing, kind of what we were all intended to do. So, what is osteopathic medicine? As I see, it's really the origin of the holistic idea, the holistic approach in the U.S. anyway. Of course, there's older traditions in the East and Europe and different places. They use the word holism in the writings that I've seen. So the holism, holistic approach. DOs practice in all medical specialties in all 50 states. We do all the same things. And we learn all the same things that MDs learn, except we learn a little bit more, and this is this osteopathic manipulation, osteopathic manipulative medicine, osteopathic manipulative treatment. And again, another confusing, because if I'm saying osteopathic manipulative medicine, you're thinking medicine. But osteopathic manipulative treatment, it's the same thing, all the same thing. So OMT, if you hear me say OMT, osteopathic manipulative treatment. There's numerous forms, techniques of osteopathic manipulative treatment. Craniosacral, a lot of people have heard of. Myofascial release, muscle energy, balanced ligamentous tension, facilitated positional release. There's all these different types of OMT, and then there's over 1,000 different ways to use those techniques. And then even I've noticed that there are whole practices built off of one type of osteopathy that exists now. So we go through, it's 300 to 500 hours in medical school on top of everything else we learn in the first 2 years of medical school. And then you spend the third and fourth year when you do your rotations. So you go through all the different specialties, surgery and internal medicine and obstetrics and pediatrics, all the things. And then you kind of learn how to integrate that into all the specialties. So you're learning the regular medical things and at the same time how osteopathic manipulation fits into all these different specialties. And then for me in residency, I did a family medicine residency and with OMT, so that it was kind of combined together. So for me, there was 7 years of training just to, before I was ready to practice and be a doctor and do the things that I do. So then why is it called osteopathy? That's our friend Andrew Taylor Still. That's kind of a famous picture of him regarding a bone. So the osteo is bone, pathos is pathology or disease. And he said the bone, the osteon, was the starting point from which somebody else quoted this, was first able to ascertain the cause of pathologic conditions. So it's sort of a confusing name, osteopathic, doctor of osteopathy or osteopathic treatment. It has to do with it, but it doesn't. What I think he was trying to express, and we'll get into this a little bit more, the cause of it's at the deepest layer. So if you think of the skeleton, it's kind of the furthest down, the deepest layer that there's there. So let's go through a little bit of the history of osteopathy. So again, it all starts with this fellow named Andrew Taylor Still. He was born when he was born, and he was the son of a minister. And at some point, they moved from Virginia to Missouri. If I recall, something in relation, what is that? The Kansas-Nebraska Act. During the Civil War, when they made this decision, Kansas-Nebraska, they could decide where slavery was. But anyway, his father, he and his father, they were both abolitionists. And he fought in the Civil War. So very much, that's a big part of his story and his history. And he learned from his father, who was a physician, and practiced allopathic medicine for a long time, kind of in the tradition of the day, which is snake oil and bloodletting, all these sorts of things that he did. And in 1864, 3 of his children died from meningitis. And it was from that, and a brother addicted to morphine. And from that, he saw, there has to be another way. An interesting parallel I just realized, if we know Wim Hof, he had a similar instance where a tragic event happened. His wife committed suicide. It was this horrific thing. And in that suffering, he said, there has to be something more. There has to be a deeper way to help people help themselves. So I found that an interesting parallel. And he discovered osteopathic medicine. He didn't invent it. That's kind of a clear thing. He never said, I invented this. But it was born from tragedy, and he's raised by a minister. There's some deeper spiritual aspect to what he intended when he first came up with these concepts. So osteopathy is discovered. And he researched his techniques for 10 years before he flung to the breeze the banner of osteopathy. It's another thing they make you memorize in medical school. You have to learn all this stuff, and which is good. And he went around forever treating people and developing his techniques. Again, so you're in the late 1800s. He probably did what are called lymphatic techniques. He did HVLA, we call it in osteopathic medicine. That's the cracking sorts of things, different things like that. And on May 10th, 1892, he founded the first school. That's interesting because that's my birthday. Not 1892. I'm a little younger, but I knew it was 1892. Well, it was May 10th. And in the first school, in the first class, there were 21 students, including 6 women. So it's kind of building this picture of, of inclusivity, of there's something deeper, there's something more that exists. And he very much looked at this as a philosophy or an art form. I remember a story. He would say when he would go to treat people, he would have them stand, and he would just go and stand by them for several minutes, as if he were intuiting something, feeling something, knowing something that was going on. So he taught techniques, but he encouraged people to sort of find their own way in it all. He wouldn't even allow pen and paper in his classes because he didn't want people making protocols and it has to be in this form and be this way. It was sort of the idea that if you understand the underlying mechanism of how this thing works, then you can interact with it, not do something to it. And the doing something to it aspect is a common thing we see today in the regular Western medical model. I'm going to do stuff to you. He even mentioned this concept of the osteopathic lesion. Lesion's it's a scary word. You see, a bone lesion on an X-ray or a CAT scan or something like that. But it's just the terminology of the day. But an all-encompassing lesion, transcending the physical, emotional, and spiritual aspects of the patient. Something deeper. He was always pointing towards something deeper, something underneath the presenting things. So there's already this aspect that exists underneath the symptoms that we see. Ultimately, he came to the osteopathic tenets, or sort of the principles, and through which the whole philosophy is built around. So unity, a person is a body, mind, and spirit. It's all an interconnected thing. Structure and function. Structure and function are reciprocally interrelated. More things we had to memorize in school. When one improves the structure of a system, you improve the function of it. And then I think it was very much in relation to the musculoskeletal system, but that it's easy to extrapolate from there the structure of our cellular processes that are in our body. If you don't have the right nutrients, if there's toxicities in the body, then the system doesn't function optimally. And the inherent ability to heal and maintain that health, which is ever always present in a person. And the fourth, rational treatment is based on the integration and understanding of these first 3 principles. So this here is the kind of the core, the basis of what the original concept of what osteopathic medicine was to be. For me, I heard, and I always, no matter if I was in the office, if I'm seeing people in the hospital, if I'm up all night doing all that, I always tried to keep this in me. Actually, I went into family medicine because it gave me the biggest opportunity to do osteopathic treatment, osteopathic manipulative treatment, to do the hands-on healing aspect of things. Yeah, and I've sat and contemplated this a lot, and later on in the lecture we'll expand on these ideas. So that being kind of, when you look at Andrew Taylor Still, you look at the original ideas of what he came up with, this original philosophy of the inherent ability to heal itself. A person just isn't a bunch of pieces. They're a body, they're a mind, they're a spirit. And the structure of it and the function of it, there's some interrelation between the two. And then the way he taught the people. You know, it's not a protocol. There's not a certain do X, Y, Z. There's an art. There's a technique. There's an artful technique that kind of comes from it all. You learn this stuff. You understand. Okay, cervical vertebrae here. Feel this. Do. But it's not just their bone, move bone. There's some osteopaths who actually practice that way. But for me, this original concept, these original ideas, really resonated. So he does this first osteopathic school. All these other osteopathic schools start to open. His students go out, they start to spread the message. And then there's this period from when he developed this leading up to today. And it starts with something called the Flexner report. And that's a lot of words. And some people know the Flexner report. it was, Abraham Flexner was hired by the Rockefellers and the Carnegies to go in and shut down all the places that weren't saying use chemical medicine, pharmacology, and all these kind of things. I'm going to try my best to not go down the road of all the things, but it was there was racist connotations in it. It was this real wacky thing, and it shut down a whole bunch of not only osteopathic schools but other schools that were away from this. It has to be this way. Follow these use these chemicals. This whole concept. So from this time frame, there's this paradoxical sort of thing of DOs, osteopaths, moving towards wanting to be equal to MDs, to the allopathic profession. But what happens is there's this sort of assimilation that starts to happen. And there's all manner of different things and times, and there's some dates on there of different things. But it was this big process of we want to be equal but separate. But now we're at this point where there's full integration to a single accreditation system for graduate medical education. So there was an osteopathic board exam and an allopathic board exam, the COMLEX and the USMLE. And osteopaths could take either one. Allopaths, MD doctors, could take the one. But as I understand, now that's gone away. For board certification, doctors have to, every so many years you have to go and take a test and do board certification. If you were doing OMT, you had to go and do your board certification to show that you were proficient in it. That's gone as well now. I was, when did I do it? Last year, I think. I was in the last group of people to actually, where they want to do that, where they were doing that. So now essentially, it's osteopathic and it's indistinguishable. So in medical school, it's almost. When I was in medical school, when was I in medical school? 2004. I started. I graduated in 2008. So it's changed since then. Where in medical school you might hear these principles, and there's kind of two factions. There's people who learn the osteopathic stuff so they can pass the test, and then they want to go and be an eye surgeon or whatever the thing. So they're not very interested. And then there's the the weirdo people, and I'm in that group. The people who are like, oh, what is this kind of stuff? And we stay after and try to learn the things. And other people had some other form of something, and you'd get together. And you can feel the chi in the body, and you're doing this kind of stuff. That was always the most interesting stuff to me. So there's that aspect, and then you go into residency, and depending upon the kind of residency you go into, there's more or less emphasis. And then when you get into the real world, there's no emphasis in it. And so when I was in school, it's like all I wanted to do was the hands-on stuff. But they would tell you, you can't just do the osteopathic treatment. And insurance doesn't pay for it, and blah, 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 and all these kind of things. And whether that's intentful or that's the things. That's why I went into family medicine. I like family medicine, all the things that go along with it. I like the fact that in my practice, I wasn't just in the office. We saw people in the hospital, I saw people in the nursing homes, and I did these other things. But the whole time there was this I want to get to the core of the things. And having that experience in the the Western medical model, seeing what's less helpful opens the door to what is more helpful. So yeah, it's indistinguishable now, and I don't want to go into the all the things as to why and insurances and all this kind of stuff, but I'm pretty sure that this group kind of gets a lot of that stuff. Okay. So that's the first part of the lecture. Now here's the second part. And we'll see how to proceed. This slide all the way back. This. Those are just words, right? And words are one thing, but what if there was an experience, right? Let's have an experience. Who wants to have an experience to prove this as a potential thing that's true? Who wants to breathe? Let's breathe. Let's do some breathing. So this is born from, if we're familiar with, from Wim Hof, the Wim Hof breathing. You already have everything you need. What this one has the ability to direct what's happening inside it. We can actively engage the chemistry in our body. And the simplest way is through the breath. So let's do some. Let's see. Notice the way we're feeling right now, and then we'll notice how we feel after. So sit up nice, easy. We won't get too intense with it all. And breathe fully in and let go. Fully in, let go. In the mouth, out the mouth, in the nose, out the mouth, doesn't matter. Fully in, let go. Be fully in and let go. Continue. Fully in and let go. Fully in, letting go. Continue. As we do this, fully in, you're building up oxygen in the body, you're getting rid of carbon dioxide, the system's becoming alkaline. You're actively engaging your body's chemistry, fully in, letting go. It's shifting. We have the active ability to engage with our central nervous system. Fully in, letting go. Fully in, letting go. Deeply, fully, let go. Continue. We'll do a few more. Fully in, letting go. Fully in, letting go. You may notice numbness, buzzing, tingling. It's just your nervous system activating. Breathe fully in, let go. Fully in, let go. We'll do 3 more. Fully in, let go. Fully in, let go. 1 more. Fully in, let go, and stop on the exhalation. Close your mouth, stop, don't breathe. Just pause, wait. Sit. Observe, witness. Notice what's happening in the body. You don't need to breathe. You've built up oxygen, you've blown off carbon dioxide, your system's alkaline. At some point, the drive to breathe will come. And when it does, take one last full deep breath all the way in and hold it for about 10 seconds. Fully in, hold it. Five, four, three, two, one. Now just notice if you did the breathing. Your state changes when you really get into that. You didn't need anything, you already had it, oxygen. We can engage this one in a way that's without needing anything external, anything from outside of us. It's already present, and that's just one of innumerable different ways. So, again, there's something that's present already. There's something we have. Andrew Taylor Still, he pointed towards it, and we utilize it in my practice through osteopathic treatment. But that's always ever present no matter where you are, no matter what system you're doing, no matter what technique there is. It's always there, this thing, there's something there. So the title of the lecture, it was originally a new model to make the existing model obsolete. It was born from that quote earlier. So let's talk about the model. When I originally made this slide, it was the Western medical model. And as I sat with that, again, we can get into the Western medical model and all the things about it that a lot of us know about already. But it's the model. There's no bad practice or technique or modality. Sometimes we need the chemical medicine. In acute treatment, if I had bacteria in my blood and I was dying of sepsis, please give me IV antibiotics. There's a bone sticking out of my leg, I would love some pain medicine and some surgery. Right? There's those aspects of it, but it's this model. And the biggest issue I see with it is it's one of kind of codependency. And this is when you hear about, disease management. And that disease management, it takes lots of different forms. And what it does is it sets the goal, it sets what we're trying to achieve or what we want, what's needed outside of us when it's already present. So we set up these things of go to the doctor, take these things, continue on, come back, come back, come back. We all know this sort of thing. So the way it's this codependent model. So this idea of creating a new model, what could be the new model? How about a modelless model? Kind of going back to this original idea of what Andrew Taylor Still elucidated, like there's certain foundational things that are true, that are important, but when we try to box individuated expressions of infinity, the thing doesn't work all the time. But can we find something that's present through all of it? So an interdependence. This is I think it was coined by Thich Nhat Hanh. In interdependence, he always used the flower. And the flower is made of non-flower elements. So if you look closely at the flower, you can see the cloud. You can see the rain. You can see the gardener. And if you remove any one of these aspects, the whole thing collapses. So what's a way we can move from me, doctor, you, patient, do these things, to an even ground, to a interdependent aspect of things. And I think the first thing we need to consider in this is the idea of what is health. And if you ever sit and what is health? Right? If you look at the textbook definition, it's the absence of disease. Right? As if disease is the norm. As if it's guilty until proven innocent sort of thing. Right? And when you think about it in those terms, it's this thing that we have to get to. It exists in some other point in time and space. Right? And then what is disease? Right? So it becomes, for me, health is kind of experiencing more goodnesses than badnesses in a very general kind of way. But yeah, it's out there, it's somewhere else, it's not here. We'll get to it eventually. After you satisfy certain criteria of doing X, Y, and Z, then you'll be to this point of health. But when we look back at the original concepts and principles of osteopathic medicine, you can start to extrapolate these things out further. So the first principle being this one is a body, mind, spirit. And there's unity. There's one thing. That's not only true with this, there's a deeper element to that. One thing. Science proves this. Quantum physics proves this. There's one unified field that exists to and through all of reality. And it's interconnected. And there's all manner of experiments and things that have proven this. So it's not only true in this one, there's a grander, deeper truth that extends from it. Structure and function. Again, as Andrew Taylor Still elucidated, the structure of the body and the function of the body directly related. But there's something more to that. It's how this one is how this one is. And we hear things like the law of vibration and the law of attraction. How I hold this one determines how it expresses itself. And the work of people like Joe Dispenza are really awesome at describing how this works. For example, if we think of something that happened in the past that made us really angry, and you call that to mind, and your heart starts beating, your skin gets, real physiologic changes start to happen in relation to just a thought, just to hold a state, in a psycho-emotional state. And the opposite of that is also true. I hold and feel the state of goodnesses. I feel happy, I feel joy. And when you reproduce that feeling, the fact that you're reproducing that feeling means your body has to be producing that chemistry. So we have a choice and can literally manipulate the chemistry that's happening in our body. The Wim Hof method in all its form does that as well, where through breathing and the other parts of that, you can learn how to engage this one. How this one is how this one is. And even broader aspect of that might be the law of karma. Good, good, bad, bad. And none escape the law. That's a quote. Right. What this one is and feels is what happens. So there's something bigger that goes beyond just structure of the body and function of the body. And the principle of self-healing, self-regulation. Right? That's always true in the body. How do we know that's true? Because we've heard a person had stage 4 cancer, and they did the thing and it was gone. The person was blind and now they could see. They were paralyzed and could walk. These things we define as miraculous. There's a it's always ever present thing that's underneath. That's always there. As is nature. Nature regulates herself. We don't need to do anything. It's happening already. There's something that's here in us, available all the time, already. So it was really sitting with those three, or these four, because there's the fourth, which we'll get to too, things. And so this has kind of led me towards this deeper. How do we reinvigorate these original concepts of osteopathy and bring them into a modern day kind of idea? So again, when we look at these ideas, and of course the fourth principle being the practitioner's rational treatment is based on the understanding of these ideas, right? These things are always ever there. The inherent ability to heal ourselves is ever present. So then the question, well, I have this process going on. I have these diseases happening in my body. I have this pain. I have whatever it is going on. Yes, that's true, and at the same time, never not, there is this mechanism. And we think we have to do certain things and satisfy certain criteria in order to get to the thing that's already there. But it's already here. It's like saying, how do you get to the metaphysical library? And the whole time you're there. So there's simply it's kind of one of these things where it's always there, yet there's this aspect of us that doesn't realize that it's there. So it becomes this thing, how do you interact with what's already there? How do you realize something that's already present? So we have to get to this element of what or who is the interactor, and is there a conscious ability to step into that and just merely realize what already is. And I think maybe we'll do a thing and we'll see what that is. Who's familiar with the snake and the rope? The analogy of the snake and the rope. It's in the various Eastern traditions, and the idea is that it's dim out and you're going around the corner and, oh my God, a snake! And really it was a rope curled up. There's a misidentification of what is. So that's this idea. Here's this thing that's here all the time, all the way, and it's purely a misidentification. But the whole time it was the rope. The whole time the inherent ability to heal ourselves exists. And there's a new term I coined. The I already amness. It's already present. And again, the current model suggests you're broke and need fixed. Right? What I'm pointing towards is the idea that what's needed already exists. So what if we learned how to identify and recognize that as individuals, but then as the practitioners? Because there's two sides. You don't need both sides. You doing that is enough. Then you can go to your regular doctor and really understand, well, they say this, do that. You'll know, but you'll know inside yourself what's needed in order to express this idea of health. So So now it comes further down to this idea. This is, I guess, it's a Zen concept of not two, not one. And we relate this to, going further to this idea of the doctor-patient relationship. This starts to be how I work when I do what I do. The idea that there's two of us, there's me and then you, when you closely look at that, is not true, because we defined there's oneness. Yet at the same time, in our experience, there's me and there's you. So there's not one. So the answer is that not two, not one. There's this. And then the minute we go to label that or box that, it's lost. That thisness, that isness, the thing that exists right now. So it's through that, all these concepts, but then this idea of we're not separate. And when the practitioner and the practitionee come together, if there's this difference in I'm doing something for you and I need something done for me, this is the current model. But what happens when we engage in it where you really know you're already well? That mechanism exists, that's just the baseline normalness of the human mechanism. It's true all through the rest of nature, why not in this one? And then what if the practitioner really understands that and sees you in that way? Now, we move this way, and now it moves from that kind of codependent, you need to do certain things that I say because I have a stethoscope around my neck and letters after my name, towards you actually become the healer and the healed. Then engaging with the doctor knowing that I am no longer just the healer. I am also the healed. So now there's this shared dynamic that happens. And for me, that's the way that I work. Whether or not I tell the people who come in that you have the inherent ability to heal yourself, and I guide them to a certain place, and I've done that with certain people, and they've noticed some major changes. Or not. That's the lens through which I see. But if each person here already knows that exists, if they can touch it, if they can realize what's already there, then the technique, the modality, the thing you're doing becomes irrelevant. Doesn't matter if you're doing osteopathic manipulative treatment or if you're doing acupuncture, we're doing Joe Dispenza meditations, all these things. That part is secondary to you knowing what's already there, what already exists. It's never not true. It's never not there. So, again, those are just words. What's proof? So there's proof of it working. And I wrote this out like we do in Dr. Land. 42-year-old male patient, blah, 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 just because I thought it would be cool. But history of low back pain from a herniated disc. Lots of pain in the lower extremities, especially the left foot, which was probably plantar fasciitis, and being overweight. Pain was through his whole body, focus in his lower extremities and back, left foot, heel, to the point where getting out of bed, would limp out of bed, sometimes had to crawl, limp down the stairs, go down on his butt down the stairs. Couldn't go hiking for long with his beautiful girlfriend. It was, really difficult thing. There was the weight, and even noticed that, eating to cope with all the things. So this person, really started to not just keep these ideas as a philosophy that he learned in medical school over the years, and it start to actually, what if it's really a thing and it's really real inside this one? And then he noticed, as he was giving his lecture at the Rogue Valley Metaphysical Library today, that something shifted. And it was towards the end of the year, beginning of the year, something really started to shift. This idea of that inherent ability to heal oneself exists already. Okay, that's a thing. No, really. Okay, no, really. And then sat in that, and sat in that, and sat in that. There became an identification with it. And once that started to happen, once the, I don't like the word embodiment, the really just knowing of what was there-ness happened, then quite naturally, my eating pattern changed. And I found a way of eating that was good for my body. And I've lost 30 pounds. All the pain went away. I don't have this horrific get limping out of bed pain anymore. I've changed the way I approach food. And it wasn't because, it's one of these, not because I'm special, but I really started to what would happen? Really? No, really. And I sat in it, And it was once this one started to identify with that, then the things I needed to do just happened. I know all this stuff. Like, you shouldn't eat crap and you should exercise, and you know that. Well, what is that thing where we know what it is we should be doing, yet we're not doing it? And it has to do with an ingraining of it. That's no more than just realizing what already is. Right, it's like if I were somehow able to morph into LeBron James' body, really great basketball player. Boom. It would just be natural for me to be able to dunk a basketball. It would just be natural for me to have the physique. It would just be natural for me to do the things of LeBron James-ness. Right? So it's when we really sit into the concept that I am already well already. The knowing what to do. There's infinite knowledge and information. We all have access to it, and everybody knows something about something, and there's this technique and all this and all that and all that. That's all great and wonderful. But there's what's the thing behind it? Now, here. And can we actively engage with it? Well, how do you engage with it's already here? It's already present. Now, what happens when you know that and I know that, and then we come together and work together? Now it becomes this amplified thing. And people often, how do you do what you do? What are you doing right now? Because sometimes it sounds like I'm just sitting there, my hands. What the hell are you doing? But it's just witnessing what is. And then when I do that through my form of osteopathic manipulation, what to do just reveals itself. There's some other form of communication. But it's not just special to me, that's already in you as well. So when you sit in this space of knowing that, you're the healer and the healed, I'm the healed and the healer. Now the one thing, not dependent upon an external thing. And any practitioner, through whatever form it is they're doing. So this is this idea of the new model, where we start from it's already there, as opposed to it's some health is somewhere out here that we have to get to after we satisfy some criteria. We frame this thing, it's like dangling the carrot in front of the horse. And never actually getting there. And the whole industry, there's a whole industry built on this, of do these, and it's this chasing after sort of thing. It's not to say that we don't need, support, and we don't need, to go to the practitioner every now and again to remind ourselves of it. But one can totally free themselves, and you don't need anybody else because it's already there. And then inherently you'll know the thing to do when you sit in the space of what that isness. So really that happened to me. It didn't happen to me, it happened as me. When I said, because I knew, the things, but yet I get to some point where it's like, no, really. And it's like this, it's this mantra. It's here already, but what about, no, really. But this, no, really. Really. And what's happening in that is the becoming aware of what already is. There's an actual change in the body's physiology that's happening. I am holding the state in this electromagnetic reality that exists. There's an electrical signal and a magnetic signal, as described by Dr. Joe Dispenza. And when these two things are in coherence, reality responds to it. So it's not just a floaty, I am well. No, really, there's actual changes that happen through this mechanism, and then the behaviors, and then the things show up. It's another thing too. Things showed up. I remembered a certain practice that I always did. I started to do it all the time. There was a friend I met, and then he was like, let's work together, and then he showed up again. And I started doing these different body work, or not body work, but body positioning, movement exercises, and these kind of things. So it's available to all of us. So then now what happens if a whole group of people start to do this? And people come together where everyone is the healer and the healed at the same time. And we sit in an internal state where our chemistry is actually changing, but also an electromagnetic, vibrational, real, palpable, producible field that happens. And then people start doing that. Well, I'm glad you asked.
When do we start?
Thursday. Across the street in my office. I was going to name this or call, we have to give names, right, to things. I was going to call it inner osteopathy, which I thought was a cool name. But then I was talking with somebody and they said, what about in training in truth? And I think that's a cool way. You gotta have a cool name so people like it. But what if a group of people started to do this same thing? Right? And then sometimes we need to work individually. Right? So come see me after this and I'll set you up an appointment. I wasn't sure I was gonna relate this, but I'm going to relate this. So this Thursday, and I might as well make it this Thursday. Yeah, in the front. We'll do it in the front part of the office, right here, right across this, right on the corner of Ashland and Normal. It's sort of right next to Puff's. Yeah, Puff's Smoke Shop. People like to park in my parking lot and go to Puff's Smoke Shop. So I'm thinking about. There's these two pylons. I'm going to get a banner. Addicted to nicotine? Call me. And like have it there so they have to walk past it every time they go to the place. But that might be a little conflictual. So yeah, this is something I've wanted to do ever since I moved to Ashland. I just haven't been able to find the form and the way to do it. And I've kind of sat with this, and I have an idea where we can do this. So if you're going to come, and if you're going to come, I have some, pillows, there's chairs, there's little benches, things like that, however to be comfortable. But I've kind of came with a, there's lots of talking and words and descriptions, but there's a real experience that's here already to be had. And it's a lot, and I was thinking about maybe I'll guide the people to that, but we'll save it for another day. What else? So that's the thing. Yeah. It's all right. We'll get it.
Yeah, that's it.
I really didn't know how the second half of it would go, because it's, there's this history and there's these ideas and there's concepts and all the things, and then there's how do you point to what's already here? How do you? It's already, and how do I convince you that it's already? It's just me saying stuff. But look at, and I'm betting. There's something to be had, to be felt, to be experienced, and it's here already. So let's do that. Now we free ourselves from the system of codependency. We keep, great medicine, keep it. Surgery, keep it. Supplements, keep them. All the things, all good things. Secondary to you, it's here now, really for real in real life. It's not. And you. How do I know that? Because nature. And this is just a piece of nature. So there we go. Now, Heather.
Yes, I just wanted to say that I am a massage therapist. I was trained as a massage therapist and an acupuncturist, and I took some training in uplifters craniosacral. And in that craniosacral class, it was a doctor of osteopathy that held the spinal cord during the neck surgery. So that was my introduction into the doctor of osteopathy. And then, when you were doing the work on me, I just kept telling you, what are you doing? What is it that you're doing? And you told me, I'm taking system into the place where there is greater pleasure. So, and you said you also learn by petting a cat.
Yeah.
So there's a quality of the touch, because I had always gotten regular chiropractic manipulations for my neck. And you were the first person who ever did an osteopathic manipulation on my neck. And it was, you can't use the word fixed, but I was fixed for many months. And all of a sudden I realized how amazing this was, and I just wanted to know how to do it so I could help other people. And you know what? I imitate what you do on my clients. And they tell me they feel so much better and their pain is gone.
We had that conversation about, like teaching other people the things, So that could very well be something.
And so I tried to apply what you taught me into my practice.
Becoming aware of what already is. Where are my clothes? So there's a drop, it's here. Really, for real and real, it's here. Yes.
So I was curious about that, because I've been to you several times, but we didn't have that conversation in terms of who I was to be, or the invitation, and I wondered
Invitation.
if,
That's a good.
yeah,
The
good. Well, I mean,
invitation,
I completely get where you've been coming from and your mindset, about the truth of the matter. And yet my question before, this popped up on the screen called Come for Entrainment, and find out, own more about who you are. Do you find that there is a difference in having that conversation
Yes.
with a new patient in terms of what my role
wish I
would
would
be.
have said that. Yeah.
You know,
Yes,
in
yes.
the matter of
Yes.
being on the table or being in the space of you.
There's been this length of time where I've been trying to put into words this aspect of what I'm talking about, and the constraints of Medicare office visit 30-minute time. Right? So there's this. So that's why I started to offer the liminal osteopathy session, 60 to 90 minutes. There's other thing where it's outside of insurance, where it's like, where there's more. We have more time to go into that. And there's this absolute. Damn, I wish I said this on camera, because. Oh, good. I just noticed that one off. Great. Hi, everybody. There's this absolutely noticeable change in how the body shows up. For me, when I work with anybody, I see there's this pattern plan that exists, right? This one thing that exists. And the body shows up like this, and there's disease. And then all I do is that. All I do is just bring it back to what's there already. When I've sat with people and done sort of a guided point, invitation. So much of this is born. Muji? Yeah. Muji invitation, like this invitation to be what you already are. This thing, there's a certain palpable sense of like, there it is. Happens. It's just there, and then I don't have to do anything. And then there's some people who grasp this already, and they come in and they sit in a space where they already know the frequency, and it becomes this whole other thing. Where it's so wonderful, so I don't have to do anything. But no, it's a reproducible, from my perspective, what I notice. It's not just like, oh, I'm thinking about it. No, it's like, holy heck, right, in doing that. So it's not only, it's from my perspective, but then the people get up and they're like, what the heck just happened?
Yeah, and when that isn't present, I mean, I didn't have the experience of being invited to own this, what's already there. And so it was a completely different experience for me, and versus it probably being invited, or like you say, somebody already knowing kind of innately that who they are is their ultimate healer, and they've come to be with you to open up something more to the ultimate healer.
In one form or another, like even for me, I'm always holding this idea, and then if conversation's happening or what, I'm always kind of guiding to it. It's just been, and here I am, recently, where it's like, now let's actually start to make this a thing. There's probably some way I could create like a guided meditation kind of thing, or something that could be a reproducible thing that people could do them for themselves. So maybe there's some resource or way I can find to like have that happen. So it's been this whole this big long process of it, right? And it's noticeable. It's noticeable. What's already there is noticeable. Yes, ma'am.
I just wanted to mention my first encounter with you. I mean, I was kind of resistant to coming because I was very attached to the other osteopath. But I made an appointment, and I walked in the door and I looked at you, and you were so present. And I felt seen, and I saw you, and then we just did it, or were it, or whatever. So there was nothing really to do. And that's my experience. Every time I come, I lie kind of like, oh, and then I lie down and I go, I'm back. So it's about being totally present. And there are no words for it. I don't have words for it, but I experienced it right away with you.
That's it. That's where it is. It's in this wordless place that's nowhere else than already here. It's in this kind of wordless. It's there's layers even beyond this. Watch Muji, read Ramana Maharshi, Swami Vivekananda, Ramakrishna, the Vedanta, the non-dual kind of ideas. There's one thing, and it's not a thing. This aspect isn't found in form. There's body, mind, in this world. And we talk, and it's all an illusion. What's that mean? There's a witness that exists. This is the way to guide the person into it. We become aware there's this room, and there's something that they're aware there's this room. There's this body, yet there's something that's aware there's a body. There's the mind, yet there's something that's aware that's behind it all. And it both is it and isn't it at that same. And you get into these kind of paradoxical Taoist kind of yin-yang kind of concepts of things. But really, for real in real life, there's that. Then there's the liminal space. This is really the liminal osteopathy. There's that is the witness who sees health and disease, who sees form and formless, who sees all the things. And then coming into form, the way the water actually becoming, just before it becomes the wave, chooses the kind of wave it's going to be. That's this access point. That's when I was talking about the identifier or whatever it was. I am that. That's the choice point. This aspect in us. What is that aspect that knows I'm conscious? When you go all the way back, it's and then when you get really stopped, it's here. And we don't have to be in some floaty float land tripping off meditative land. Present, fully here. It's here. It. Now, this. Underneath it all. And you start to see you're not only the director, you're what's being directed. Common analogy is the movie screen. You're the movie screen. The movie screen is when fire's on the screen, the screen isn't burned. When there's a flood, the screen doesn't get wet. This is an appearance in that. And when we sit in that and then engage in an intentful act to heal or to not heal, it becomes a whole different game. And it's noticeable underneath my hands. So it's noticeable underneath anybody's hands. And there's no special requirement or technique or concept or training that's needed. It's already there already. So I see that there's something in there, like this is freedom from the system. No matter what the cause or no matter what the form the label we give it. We box these things. You have syndrome X and disease Y. Yes, and that's an appearance. That's the health and disease. They're both appearances in something. What is that something? I. So that's what I sit around and think about.